Angela. I'm going to wash my hands and I'll be right with you, okay? Okay. Wash my hands with soap and water. Provide privacy by closing the door or pulling the curtain. They have a roommate. Hello. I'm Angela. I'm an Excelsior College nursing student. And I am going to be providing care for you along with your other nurses. But before we go any further, I would like to verify who you are. I would do that by asking you to state your name and your birthday, and I would match up by using my Mir and comparing it to your wristband, okay? So if you can state your name for me. Jessica Long. Your birthday? Okay. 5/8/1969. 5/8/1969. Got it. And Jessica, what would you like me to call you? Jesse? Okay, good. Okay, Jesse, what we're gonna do today, well, we're gonna do a few things today, but right now, what I'm gonna do is I'm gonna do a peripheral assessment on you, okay? So what that means is I'm going to be playing with your feet. So I'm going to be touching the skin on your feet. I'm going to be touching for pulses. Make sure you got a pulse down there. I'm going to be checking for sensation, movement, and just asking you a couple questions to make sure we're good down there, okay? Checking the temperature, your legs, check for any swelling. And you know why I would be checking your legs for any swelling or redness or in your temperature? Okay, well, those will be signs of a blood clot. So I want to make sure that we don't have anything like that going on. And then, do you know the purpose of me playing with your feet? Doing those things that I said, like checking your capillary refill or your movement or sensation. Basically to make sure the blood is running down, getting to your feet. And you got feeling in your feet and you can move your feet. And that's basically all I'm checking for, to make sure the blood is running smoothly, make sure you're in good condition, okay? Okay, so I'm going to pull the covers back, if that's okay with you, off your legs, just so I can look at your legs. Okay, and I'm going to touch your legs. Okay, and then I'm going to touch in between your ankles, the inner ankles, and I'm just checking to make sure I feel a pulse. I'm looking for a strong pulse, and you definitely got a strong pulse. Okay, and if you can wiggle your toes for me on both feet, that's good. And then I'm going to check the capillary refill on both feet. Good. Good. And then what I'm going to do is I'm going to squeeze a toe, and you tell me which toe and which foot and which toe I'm squeezing, okay? All right. Yep, left pinky toe. Yep, right pinky toe. Yep, left second toe. Right third toe. Yep, you got it. And so we look good here. Let me just jot something down. Okay. And so I see you have these compression stockings on. Now the compression stockings should be on while you're in bed, because what that do you know what that do the what the compression socks are for? Now what it's going to do is it's going to help with venous return. What it's going to do is the compression is going to just help with the blood flow. Make sure the blood is not coming down and getting stuck. It's going to come down, go back out like it should. Okay? So I'm going to put your compression socks on, okay? They're hard to get on. Well, I can tell you and show you an easy way to get those on. So let's take these non-skid socks off and get the compression socks. So here's your compression socks. So what you want to do to make it easier to go on is turn the sock inside out like such, where you have room to get the toes in there. And then what you're going to do is you're going to get the toes in there, and then you're just going to pull the rest of the sock up over your foot. Yep, that's simple. It's hard when you have it open like that and you're trying to squeeze your foot in there. So yeah, once again, you'll turn the sock inside out. Leave enough room to get your toes in there. Get your toes in there. Roll the sock right on up. Okay? So keep those on now that you know what those are for. And you'll be all good. Okay? And I see your feet is just lying here on the bed. What I'm going to do is put a pillow under your legs. You know what the purpose of that is? Well, the pillow, I'm going to elevate your legs. It's going to take some pressure off those heels. That's first and foremost. And also elevating your legs also helps with blood return. So you get a 2-for-1. Okay, let me get you a pillow. Okay, that's too small. Let me get you another pillow. Okay. Here you go. Had to get that out your closet. There we go. That should provide some comfort for you also. How does that feel? Good? Comfortable? Okay. So, overall, how are you feeling? You are comfortable? Okay. And was anything we did uncomfortable for you? Okay, good. So if you could tell me 2 things that you remember us talking about. Yep, about your legs, your feet, your, Yep, you can turn the socks inside out at the toe, enough to get your toes in, and just roll it up. Yep, and it was easier. You say it would look like it was much easier. Yeah, you see how easy it went on. Yep, so that's good. What else can you tell me? Yep. Yes, exactly. When I'm checking for your temperature and swelling in your legs, I'm trying to make sure there's no blood clots or anything. Exactly. Okay. Well, we are all set. And if you don't need anything else from me, I am going to go do some charting. Is it anything you need before I leave the room? No? Okay. So I just want to make sure your side rails are up. Car light is in reach. And you know how to use this car light? Yep, just push that button. Yep, Jesse, you got it. Bed is low and light. Do you have alarm on the bed? No. Okay. And there's no clutter or anything on the floor, so we're good there. Let me jot some things down real quick before I leave the room because I will forget. So just a minute. Okay. All right. Well, that's it. Like I said, if you need anything, just push that call light, okay? And we'll be out. We'll come and assist you, okay? All right. Thank you. Please subscribe. And the documentation will be in the description area below. And every time I say, when I say, let me jot something down before I leave the room so I don't forget, what I am doing is going over my mnemonics. What I do is I do my patient care. I don't use the mnemonics. I don't think of the mnemonics in my head. I just do what I know I'm supposed to do for each area of care. I just do it because if you're sitting and you're thinking of doing your care and thinking of your mnemonics in your head, first of all, you're going to move slow because you're thinking as you're working, where you know what you got to do. So just do what you got to do and then use your mnemonic as a check off. So before you leave the room, you check off, put a line through your mnemonics that you did each one of them. So once again, you know what you got to do. Go in, do what you got to do. Then go look at your sheet before you leave the room and use your mnemonic as a check off. Simple as that. Don't be in there, okay, P for pause, blah, blah, blah. Don't do that. You already know what you got to do. Do it, and that's for any of the patient care scenarios. Do what you got to do first, or do what you remember. If you don't remember everything, do what you remember. It doesn't have to go in no specific order other than a 20-minute check. So do what you remember first. And then if you get stuck, look at your mnemonics. Don't turn in your paperwork to your CE unless you looked over your mnemonics and you know you did everything. Because if you leave the room and go chart and you're going over your mnemonics and you forgot to do something, guess what? You didn't turn the paper in yet. So you can go to your CE, wherever they are in the break room, wherever they are, get them and say, hey, I forgot to check the temperature of the legs. They'll go back in the room with you and you check the temperature of the legs. Then you go back and chart it. As long as you don't turn it into the CE and say, I'm done, you can go back to the room as many times as you need to. And that's that. Thank you. Please subscribe.